How do you understand complex diagnostic genetic test results? Imagine trying to solve a puzzle where some pieces are clear, some are blurry, and others don't seem to fit at all. That's what understanding complex genetic test results can feel like. When you get your results from a genetic test, they can tell you a lot about your health, but sometimes they're not straightforward. Let's walk through how to make sense of these results step by step. First, if your test shows a positive result, it means a change in your genes has been found that is linked to a disease or condition. This change is called a pathogenic variant. It can confirm a diagnosis or explain symptoms you might have. But remember, a positive result doesn't always mean you will develop the disease or that it will be severe. It also means your family members might carry the same gene change, so they could be at risk too. If your test results are negative, it means no harmful gene changes were detected. But that doesn't always mean you are free of genetic risks. Some mutations might not be caught by the test, or the cause of your health issue might be in genes not tested. So, a negative result still needs to be looked at alongside your medical history and family background. Sometimes, the test finds a change in your genes, but there isn't enough information to say if it's harmful or harmless. This is called a variant of uncertain significance. These results can be confusing and often requiring more research or testing in family members to understand what they mean. Genetic changes are described at two levels. One is at the DNA level, like C, 1592GA, which shows a specific change in the gene's building blocks. The other is at the protein level, like PTHR531MET, which shows how the change might affect the protein that the gene makes. This helps scientists and doctors understand if the change could cause problems. Variants are classified into categories based on how likely they are to cause disease. They can be called pathogenic, likely pathogenic, uncertain significance, likely benign, or benign. If a variant is pathogenic or likely pathogenic and matches your symptoms, it can confirm a diagnosis. Doctors interpret these results by combining what the lab finds with your medical history, symptoms, and family background. This helps them decide what the results mean for your health and what steps to take next. If a positive result is found, your doctor might suggest testing family members or starting preventive measures. Because genetic traits can be inherited, a positive result can also impact your relatives. Genetic counseling can help explain these risks and guide testing options for your family. Sometimes, further testing or monitoring is needed because not all results are clear-cut. It's important to remember that genetic testing is just one part of understanding your health. Results might need more research or follow-up with specialists. Always talk openly with your healthcare provider or genetic counselor to fully understand what your results mean and what actions you might want to take.